All right, good afternoon, everybody. More good news to report today. We have no positive cases of COVID-19 in the community in New Zealand today. Results back from wastewater testing for Tuesday, the 22nd of June, shows that COVID-19 has not been detected in any of the sites around Wellington, the Hutt Valley or Porirua. Again, another encouraging piece of news. A total of 10,749 tests were processed yesterday. 3,713 of those were here in Wellington. Demand does continue to be high for testing. We expect around 4,500 tests to be completed today. Further testing stations are opening, so a new testing station opens today at Te Papa in central Wellington. That's on top of the additional testing sites that opened yesterday in Haitaitai, Karori and at the Wellington Regional Hospital. The permanent testing station in Taranaki Street is near capacity. I think it's the testing station that people are most familiar with, but there is availability at those other testing stations throughout the city, and people will be able to get a test if they're symptomatic or if they've been at a location of interest. Wait times are reasonably low. There's also availability across the Wairarapa and the Kapiti coast. Demand, I'm told, in the Hutt Valley is very high, so go the Hutt. Wait times are pretty steady around the rest of the region. A reminder, if you know someone who was at a location of interest, but you yourself were not at a location of interest, you do not need to test and to isolate, but we do ask that you monitor your health. And if you start to show symptoms, then to isolate and to call Healthline for further advice around whether you need to get a test. It's also important to check the relevant times of interest. If you weren't at the location of interest in the relevant windows, then you don't need to be concerned, but you should continue to monitor for symptoms. Today marks 5 days since the Sydney case left Wellington. That means that someone who was exposed during that time could have started to show symptoms by now. So if you're at a location of interest and you've already had a negative test result earlier this week, that doesn't completely rule you out. So make sure you continue to monitor for symptoms for at least 14 days, so through until at least another week. It's important that we all stay vigilant, and that includes people who were on the 195 Air New Zealand flights that took off from Wellington over the weekend and on Monday. That's flights across the country and, of course, Trans-Tasman. So if you are elsewhere in New Zealand, but you were in Wellington over the weekend, you also need to check the locations of interest page on the Ministry of Health website to identify whether you were at one of those locations of interest. If you are, then please regard yourself as living at alert level 2, even though you are not currently in the Wellington region. It's reassuring to see that so far New Zealanders have been doing the right thing. Testing numbers are up overall, and I want to thank people for their response so far. I want to thank our frontline health teams who stood up testing very quickly and are working very hard to do the contact tracing that we need to see happen. If we all follow the public health guidance, it will help to keep us all safe. So looking ahead to the weekend, on Sunday, Cabinet will meet virtually to discuss the latest evidence that we have and the decisions that we need to make. We'll look at whether any new cases have been identified. We'll be looking very closely at the testing results and numbers of tests and how that relates to the number of contacts that have been identified so far. We will obviously get the latest public health advice, and the Director General will be able to give us the latest advice from his perspective as well. And we do expect to have further wastewater testing to consider, again, which is another interesting and useful piece of information when we make further decisions. If we decide to extend the alert levels, we would do that on the basis that we still needed to do more contact tracing and testing, or because there was some further need to do that, in order to provide ourselves reassurance that we don't have community transmission. The alert level 2 measures do significantly lower the risk of any transmission, any further transmission within our community by limiting those gathering sizes and so on. If the decision is to lift the measures at that point and return Wellington to alert level 1, it will demonstrate that we've got a high level of confidence in what we are seeing. So it will likely be a finely balanced call, and we will make that decision based on all of that information on Sunday, and we'll be communicating that on Sunday afternoon to you. So I'll now hand over to Dr. Bloomfield for a bit more detail, and then we will get into questions.
Thanks, Minister. Kia ora koutou katoa. So there are 2 cases to report in recent returnees in our managed isolation facilities, and as the Minister said, no cases in the community to report. As we move through this next day or two, it is critical that anyone who was at a location of interest at the relevant time, or anyone who has COVID-19 symptoms, get a test if they haven't already. There are a number of sites for testing in the Greater Wellington region, over 50. Please do call Healthline ahead to make an appointment. And if you are no longer in Wellington but were at a location of interest or indeed have symptoms elsewhere in the country, the same advice applies. Please do check those the website for the places of interest and the advice to you. As we've said previously, many GP and urgent care clinics are providing testing, and if you're going to one of them, please call ahead to get instructions, as their testing procedures do differ from clinic to clinic. Now, Regional Public Health does have a process in place to give priority to people who have been at locations of interest or who are symptomatic, so it's very important that people ring and book ahead. There is additional staffing at all the testing centres, and I want to do a shout out to Whanganui DHB, from where 4 public health nurses have travelled down today to help out with the testing here in Wellington. In terms of locations of interest, as of this morning, there was a slight amendment to a location of interest at Wellington Airport, and our advice is to anyone who visited the gents' toilets on level 1 at the north end of the main terminal, that's adjacent to the food store, between 9:15 and 9:30 a.m. to isolate at home and contact Healthline for advice about how to book a test. And a reminder also that all of our instructions for people who have been at locations of interest are underpinned by a Section 70 notice, so this is actually a legal requirement to follow the instructions regarding isolation and testing. We still don't have the information from our Australian counterparts around the genomic sequencing results, and as I said this morning, that is due to sickness in the lab that processes the genomic sequencing there, not with COVID-19 I might add, but we know they are very responsive, that is our Australian colleagues, and they will let us know as soon as they have that. We're expecting it later today, all going well. We do, however, have that strong epidemiological link to the current cluster in Sydney. In terms of contact tracing, as of 8 a.m. this morning, 1,752 people had been identified as contacts and are in our national contact tracing database. 550 of those people are required to isolate for 14 days and be tested at least twice. The remainder are to have that day 5 test, and then if that is negative, they are able to leave isolation and just monitor symptoms for the balance of the 14-day period. So far, of those 1,752 contacts, 532 have returned a negative result, 8 have returned overseas, and for the remaining 1,212, we are awaiting a test result. It is just not yet due to come through because they were tested at that day 5, but those will come through as the day passes. It's good to see increased use of the app today, with more than 300,000 more app scans than the day before, up to just under 900,000. But I do want to remind people that the app is incredibly helpful in these sorts of situations. Please do use it wherever you are in the country. Finally, ahead of the weekend, just a reminder about what Alert Level 2 means in Wellington. Physical distancing, where possible, keep 2 metres distance in public and in supermarkets and other retail outlets, and a metre distance between people in workplaces, cafes, restaurants and gyms. Face coverings must be worn on public transport and domestic flights, and we strongly encourage their use in places when you're out and about where you cannot maintain physical distancing. There are limits on social gatherings of no more than 100 people, and this includes at weddings, funerals, birthdays and tangihanga. And businesses, of course, must display a QR code and provide an alternative contact tracing system for those who can't scan. For the remainder of the country outside the Greater Wellington region, remember Alert Level 1 is not Alert Level none, and all those good public health behaviours that have served us so well to date in our response to the pandemic remain a key part of our defence against the virus. Thanks, Minister.
Far away.
Given all the information that you have now, what is your current assessment of the risk?
I'll ask the Director General to comment on the risk. Obviously, I'm encouraged by what we're seeing, but it is still quite early in the piece.
Yes, so the cumulative negative results is encouraging. The wastewater testing being negative from Tuesday is also encouraging, but we will be looking for the test results from Wednesday and Thursday this week. We should have those through by Sunday. I think the fact that the very close contacts of this person with whom they spent the whole weekend have returned negative tests, and I've just been informed that the follow-up tests of the 2 close contacts who are in Palmerston North have also returned negative. That is encouraging. But as we have seen from this virus, both here previously and not even with the Delta variant, if we think back to Papatoetoe High School, one student who wasn't a close contact in that whole school did return a positive test. So I would say we're not out of the woods and we need people to be tested. We need to maintain our current approach of being cautious.
Gina.
Did New South Wales downplay the threat of COVID over there in their advice to us?
I don't think so. We obviously have been monitoring very closely what's been happening in New South Wales. They've been very free in sharing information about their case investigations and their testing results. It does show, though, that situations move quickly when it comes to COVID-19. They are in a very different position today than they were 7 days ago at the beginning of last weekend.
How closely are you looking at Melbourne now that there's 2 cases there?
We keep a very close watch on Australia generally. We have a variety of different things that we've set out in our Trans-Tasman bubble guidance, but we do watch that very closely, and we'll be watching that very closely in the next sort of 24 to 48 hours, obviously.
Do we just need to shut the bubble completely until they're under control over there?
We'll monitor very closely what's happening in other Australian states. We've obviously got a pause with New South Wales, which we've just extended. I think today's announcement over there, which I understand there's just been an announcement over there, I think that reinforces that was the right thing to do when we made that decision.
Just on the 22 new cases in Sydney today, do you welcome their lockdown? Are you surprised that it's taken so long for them to lock down? And is there a problem when one state's so obviously out of step with the other hotspots? Like, is Sydney a team player, do you think?
I think all of their states have a slightly different approach, and that's just the way the Australian system works. New South Wales do have a very good contact tracing system, and they do lean heavily on their contact tracing system. So I think they're probably a bit slower to use some of those lockdown type restrictions than other Australian states are. Those are ultimately decisions for them, though. I'm not going to tell them what's best for them in their circumstances. We work very closely with all of the Australian states to get the information that we need in order to be able to make decisions for New Zealand.
Why did you extend that quarantine-free travel pause for 12 days? It seemed like a big jump. On what basis was that made?
Based on what we were seeing out of Australia and the numbers. Also, that need to give people some certainty about how long they could find themselves there. And then we will work now over that 12-day period to prepare contingency plans so that should we be in a position not to remove the travel pause at that point, that we have alternative arrangements in place, which was the work we did around Victoria.
The same way, the 14 days from the pause, people will be able to come home?
Not necessarily. So again, it's a case-by-case basis. We had a variety of different scenarios that we were working up around Victoria. It just so happened that the public health advice aligned that we were able to bring people back with a negative pre-departure test. I couldn't guarantee that will be the same for New South Wales because their situation might be different to the one Victoria found itself in. So we're working on those scenarios now. It's one of the reasons we've got space set aside specifically for Trans-Tasman contingency in our managed isolation facilities. And so we work through all of that so that if it looks like this is still ongoing, as we head towards the end of that extension of the pause, then we'll be able to provide clearer guidance for people who might be wondering what's going to happen next.
Is Sydney lockdown hard enough? It's not as hard as the Victoria lockdown was. Is it hard enough for you to consider it? Because with the Victoria lockdown, you essentially considered it MIQ. That they had done 14 days of a version of MIQ, so it made sense to come home with a pre-departure test on roughly day 12, like you would in MIQ. The Sydney lockdown is not quite as strict as the Victoria lockdown. So are you currently looking at their lockdown and thinking, is that as strong as, as MIQ?
Look, I understand that it's only just been announced and I haven't had the details of it before I came here. But what I would say is, as I indicated before, I'm not going to tell the Australian states what they should be doing. But ultimately the results that they get from their lockdown and the stringency of their lockdown, those are the sorts of things that we do take into account as we get towards the end of our pause and make decisions about what we're doing next.
On the Sydney case, are we basically in a position now, and obviously we're still waiting for more data, but is the basic working hypothesis that he is one of the people who did not spread much COVID, and it's actually more likely if you have a sample size of one, right, that the person doesn't spread COVID. Most COVID spread comes from a few people who spread it a lot. Are we currently looking at a case where this guy just didn't spread it to anyone?
It's early days, I would say, and but I'll let the Director General comment on the risk assessment.
Yeah, look, I think, as you say, the evidence suggests that there's a smallish number of people that are responsible for a lot of spread. We've had cases here before, for example, our case in Northland earlier in the year where even though it was at that time the beta variant, the one first identified in the UK, no further onward spread. That, of course, would be our hope, and so far that looks good. I think the fact that this person had had at least one dose of a vaccine is also material. We are seeing good, stronger and stronger evidence that all the time that vaccination does reduce likelihood of onward transmission.
Currently, and I know we don't operate on the balance of probability on this, but on the balance of probability, it looks like this guy didn't give COVID to anyone else.
Well, that's why we're doing all the testing. Let's wait and see what the testing shows.
Look, we can hope for that outcome, but we can't work on the assumption that that's what the outcome is going to be. So,
the Prime Minister was saying earlier today, and just on the New South Wales border measures, that we're looking at their lockdown measures or their measures against COVID in terms of other states and our bubble relationship there. In terms of pre-departure testing, are we looking at rolling that out across Australia? And if so, how quick could that be implemented?
So it is certainly an option. It is one that we will consider over the next few days. Also informing our decision around what we do around Australia more generally outside of New South Wales. Their own internal border restrictions are one of the things that we will consider there. So there are likely to be changes to their internal border arrangements as a result of a lockdown in one state. So we'll consider all of that as well. We then consider the nature or number of any cases that were popping up outside of the locked down state, and we consider the nature of those. So those are all the things that we keep under review. Pre-departure testing can be a useful tool when applied in the right circumstances, so it is one that we keep in the toolkit. We do know that it could be applied potentially if we need to.
So just on Sydney, people from Sydney here, when this person arrived, there was 4 positive cases in Sydney. How, since then, thousands of people from Sydney have arrived in New Zealand. How concerned are you both about the possibility of them having COVID, and also are you considering making them getting tests here?
So we do have requirements in place for people who have been in Sydney at locations of interest before we implemented the pause, who have subsequently arrived in New Zealand. There are requirements in place. I'll get the Director General to run through those because they are obviously subject to a Section 70 notice which is issued by the Minister, by a medical officer of health.
Would that cover the person who came here though? Was that a location of interest?
You mean the person who's now a case? No, not at that time, because at the time they travelled, the place where it seems they were infected was not a location of interest. So everybody who has travelled from Sydney since their outbreak started has been emailed since their arrival in New Zealand, and those who have been at a location of interest in Sydney, and that, of course the number of those locations grows all the time, is required to isolate and get tested. Everybody else, of course, is encouraged and informed that they must monitor their health for 14 days since they were in Sydney or since they arrived, just as we should all be doing here in New Zealand, and get a test if they become symptomatic.
Yeah.
How soon will it be safe to say whether we've completely dodged a bullet here?
Look, I don't want to preempt the information that we're going to collect over the next 48 hours and the decision that we might make on Sunday. At the moment, I am making no judgment. All I'm saying at this point is that the results we're seeing so far are encouraging, but I'm not going to preempt what might happen in the next sort of 48 hours or so. We are certainly still in that period where there is increased risk, which is why we have the alert level 2 in place across the Wellington region, and also why we're asking people outside of Wellington who were in Wellington during the period in question to make sure they're being vigilant, that they are actually identifying whether they've been in those locations of interest and follow the requirements that are on them if they were in one of those places.
Assessment of the risk
Sure.
of the people at the Four Kings Bar who might have been given the wrong health advice because it wasn't identified as a location of interest properly. Do we know how many people were in that bar at that time on the night?
Well, the numbers we've got is, over in total, is about 100 people who are in our system who were at the 2 bars on Saturday evening. Some are some are classified as people who need to isolate for 14 days and be tested. The balance will need to isolate and be tested. The advice was updated, and that's what we do as we get more information. And I think the advice to people is very clear now in either bar about exactly what they have to do.
Consideration about what the risk is that there might have been maybe dozens of people out there who weren't isolating, who should have been isolating.
Well, what I could say, of course, is any of those people, if they had been symptomatic, well, first of all, they were getting about Wellington in alert level 2, and secondly, if they were symptomatic, then they knew what that advice was to isolate and be tested. It was a relatively short period, and as soon as we knew, we updated the advice.
We have had some informal feedback that as there was unusually bad weather in Wellington on Saturday night, that some of those hospitality establishments had lower patronage than they might otherwise expect on a Saturday night. We'll come up to that.
Yeah, how long until you know the results of the genome sequencing?
I think, as the Director General just indicated, we don't know, but we will certainly let you know as soon as we do.
Has the lack of those results, though, impeded your decision making in any way?
We just worked on the basis that it is the Delta variant and that it is linked to the current cluster that they're dealing with in New South Wales. Obviously, if the genome sequencing results told us something different, then we would account for that.
In terms of the Bluetooth functionality of the app, how has that informed this situation, this scare? Were many people using it? Were you satisfied with how many people had signed up?
Actually, I don't have the numbers, and we'll provide those, but there was certainly, it's certainly another tool in the toolkit to send out that notification to people who had Bluetooth turned on and were within proximity for a period of time. So we'll come back with the numbers.
Come right up the back.
What plans are in place in case a case does come up? Because it might not necessarily be here in Wellington, and would we find out before a 1 o'clock briefing like this?
Obviously, when we get a positive case, we do release that information as quickly as we can. And along with guidance, if that throws up further locations of interest, we release those as quickly as we can. If there's any further guidance that flows from that, we try and get that out there as quickly as we can. So we'll certainly keep you updated if anything was to come to light.
The two of you, are you kind of expecting a case, given how far this person has travelled around Wellington? Is there an expectation that a case will come up?
I've learned not to hope or fear here. We just deal with what we deal with at the time. When we look at the Northland case, for example, there was quite a lot of exposure there, but no additional cases flowed from that. On the other hand, we've seen other examples with people with relatively limited movements have thrown up additional cases. So I think we just deal with what we deal with, and at this point, what we're seeing is encouraging, but it's early days.
Do you have a sense roughly of what percentage or how many of the people for whom yesterday was their day 5 did get a test, and of those, how many of those test results have come back or are still processing?
What I would say, of course, we don't know exactly what the denominator is. In some single locations we do, but in the larger locations we don't. We've got quite a number, about around 1,750 in our national contact tracing database, and we know how many have returned negative tests. We know that the others have got tests due, but we haven't necessarily categorised those into day 4, day 5 as yet. But we will keep updating the information around negative test results. I hope they're all negative, of course, as they come to hand. But so far, very good in terms of the response by Wellingtonians to actually isolate and be tested. And remembering that the critical thing here is isolation. The test is of course helpful, but the fact that people are isolating, and to an earlier question, if we do get a case now amongst one of these people, it's helpful that they will have been isolating for a period, so that greatly reduces the likelihood of further transmission.
Just to follow up on that one, do you have a breakdown of the 532 that have returned negative results as to whether they were I know we're not calling them close contacts anymore, but the ones who have to isolate for 14 days and the ones that only have to isolate until they've returned a negative test?
Probably, but maybe ask another question and I'll see if I can pull that information out.
In the meantime, have we been a bit too, learning from the Papatoetoe cluster and particularly that third family that popped up, have we been too lax in not getting contacts to isolate in the meantime until we get a sense of what's out there? Because it was, that came out, it went to work, and that in that case there, should we have got contacts to isolate for a bit this time?
I'll share an observation, and the Director General will no doubt want to add to that. In the Papatoetoe case, there was a longer lead time for those. So we're talking about quite a defined window of potential infection here. So therefore, the potential for someone to have got it, become infectious, and passed it on to someone else is still... There's a very, very small window at this point. So if we were dealing with this over a longer period of time, then the contacts of contacts could potentially become more of a factor. But I'll ask the Director General to...
Excellent explanation there, but I'll just back to your earlier question. So of the 550 people who are required to isolate for 14 days, 248, that is 45%, had returned a negative test result as of this morning. And of the 1,200 who are just required to test and then can be released, as it were, 282 of them have returned a negative result, and that's just under 24%.
In terms of how you were saying before, you've been operating under the assumption this is the Delta variant. How has that changed in tangible terms? Like, how has that changed this approach? Because what is it, 60 to 90% more transmissible, it's thought?
Look, to some extent it hasn't changed our approach because we've always worked on the basis that COVID-19 is highly transmissible. The fact that some variants of COVID-19 seem to be getting more highly transmissible. In the New Zealand context, we've always regarded any COVID-19 case as being a big potential risk for us. So I think that the more transmissible the variant, it certainly becomes more of an issue when you're dealing with community transmission because the rate of the growth of that community transmission can be that much higher. But in terms of the way we've responded to cases where we need to squash them as quickly as we can, we've always worked on the basis that actually be ultra cautious, move very quickly where you can so that we can stamp that out. But I'll ask the Director General to...
Look, I think everyone's particularly cautious about this variant, and we are seeing it's having an impact in countries and places like Sydney where they are having a growth in cases, but in other places we've seen around the world, like the UK, where even with quite high vaccination rates, they have seen an upswing in cases with very high proportion of cases, almost all of them now being this new variant. So it clearly has got an evolutionary advantage over other strains. It is more transmissible, and what we are also seeing is it seems to be affecting younger people more than perhaps the earlier strains did. So these are all things we're watching, but the response, as the Minister said, is the same whatever the variant.
That means our alert levels need to be updated, and this is the point of Baker & Co, is that we know so much more about the virus now, particularly with the variants coming out, and that we need to have more nuanced levels. Like, what is the barrier to mandating, for example, what they've suggested, the QR codes at high-risk environments, more mask wearing? Like, if we want mask wearing mandatory at public transport now, why not have it in schools and workplaces as well? We know more about the aerosol transmission. We know it's way more infectious.
So we keep the alert levels under constant review. One of the advantages of the alert level system that we have now is having been through all 4 alert levels, all New Zealanders understand what's expected of them at each of those 4 different alert levels.
Dr. Bloomfield said the other day that half of calls to Healthline is what is level 2. So if we were going to upgrade them, would not now be quite an opportunity?
Well, the more alert levels you have, then the more potential there is for people to not be clear about what's expected of them depending on which alert level you're at. But we have made refinements to the alert levels as we've gone along, and you'll see examples of that. Mask use was not part of our toolkit earlier on in our response, and it has been much more extensively used now. And of course, we will keep the alert levels under review in the context of a growing proportion of the population who will have received the vaccine, because our response may be influenced in the future by vaccination rates.
Will Sunday's meeting discuss changing the alert levels, or is it just about whether...
No, look, the Sunday's meeting will solely be about what we're doing around the current alert level 2. But we will be looking again, as we always do, on a regular basis, whether there are further refinements to alert levels, including some of the provisions in alert levels, just to see, as we understand a bit more, not just about the virus, but also about human behaviour, whether in fact, and how we respond to cases, whether in fact there are some sensible changes that need to be made to alert levels. We do that regularly. We will keep doing that regularly.
Can you talk about the discussions that are being had about mandatory mask use outside of public transport and mandatory QR scanning specifically, and what's being considered?
Look, I've looked at mandatory QR code scanning, and I think I've canvassed this over the last year. It's nearly a year for me now, by the way. Over the last year, we've looked regularly at whether we could make QR code scanning mandatory. And there are some really big logistical hurdles there. So in principle, you could say, yep, we should do that. The reality is, how would you enforce it? If you're not enforcing it, then people will... Then it's rather pointless making it mandatory. And actually, it would add significant additional compliance, particularly for small businesses. So if you're running a shop with 1 or 2 people working in the shop, and you're saying you've got to have someone on the door, and you've got to turn customers away who aren't signing in, I think that becomes quite challenging. We want people using the QR code system, and this really reinforces the need for it. But mandatory usage of it is something that we've looked at several times, and at this point I'm not convinced that it would necessarily help us or make a difference to the actual uptake of QR codes. Come back up the back.
Just quickly jumping back on the bubble, can you clarify what is the threshold to put a pause on the entire bubble? I know we've got New South Wales in place. What would be the threshold to say no to the bubble?
Oh, look, if we started to see cases pop up all over Australia, then of course that's a pretty big red flag for us. But we will look at the details of each case that comes up, if it comes up outside of New South Wales, look at the nature of that case, the risk of potential further onward exposure, and we'll make decisions based on that. Guidance, the sort of the loose framework that we use to inform those decisions, we released it at the time of the Trans-Tasman bubble, so the conditions under which we would pause and which we would suspend and so on. We've released that, but there is a degree of needing to look at the evidence as well. Those are broad criteria, and then you look specifically at the cases to identify what the risk factors are around them. Henry.
On QR codes, obviously there's legal kind of barriers there and stuff. One of the things that other countries have done is basically masks, indoor dining or other indoor spaces.
Quite hard to eat with a mask on.
Requirement that if you, on something like level 2 where you can still go out, you can still see people, society can function, why not just have a mask on while you do it? What's the hold up? What's the kind of case against that here? So you can still let people go to the supermarket, but they can wear a mask when in the supermarket.
Yeah, we're certainly encouraging people at this point to be wearing masks where they can't distance from other people. Mask use is one of those topics, though, that we will keep under review. And if we were to see that there was justification for asking for wider use of masks, that is certainly something that we would make decisions on at that point.
Why don't you think it's necessary right now in this kind of scenario?
Look, I'm not saying that we wouldn't do it. It's something that we keep under review.
Henry asked what the case against it.
Well, we've not made any decisions on that at this point, and I'm just foreshadowing to you that they'll keep it under review.
What's the case against it?
Well, you have to look at compliance, for example, how it would be enforced, and all of those other things, and what the justification for it is. One of the things that we've been very mindful of is, while we do take a very cautious approach when it comes to COVID-19, we're also mindful of not asking people to do things where there isn't a good public health rationale for it. So mask use is one of those things where we are using masks more widely than we were previously, and I wouldn't rule out using masks more widely, but we haven't made further decisions on that at this point. Jenna, I'll come back to Jenna.
On that though, I mean, the Prime Minister is role modelling. Sorry, the Prime Minister is not wearing a mask for anything but eating or speaking in press conferences. Is she role modelling, or is she doing that because she's more important that she doesn't get COVID?
No, she's role modelling. Well, look, as I've said I think this is our third day in a row of doing this. I encourage people to use masks where they can't socially distance from others, where they're in those kind of confined spaces, if you like. I am doing the same. If you're out for a walk outside and there's no other people around, probably not that important that you wear a mask. On the other hand, if you're in a cafe or something and you're not eating or drinking, a mask might well be an appropriate thing to do.
In terms of the travel bubbles, have the cooks raised any concerns with us about keeping ours open to Australia while there is this much risk?
Not directly, that hasn't come through to me. We have had our public health teams talking with the public health teams in the Cook Islands so that they understand how we are viewing the risk from a New Zealand perspective. They did make some decisions about not allowing Wellingtonians to travel yesterday. My understanding is that Wellingtonians are still able to travel to the Cook Islands from today, but they will have to fill in a declaration, including going through the locations of interest to identify that they haven't been in any, before they would be allowed on a plane to the Cooks.
We just learned that doesn't work. A COVID case came here.
Yes, but at that point there were 4 cases in New South Wales. So,
and there are no cases here, but there was still someone that came through.
Well, if we were going to take that approach, then we wouldn't have any international travel at all. We wouldn't have any bubble.
Minister, are you aware of any symptomatic people who are still unable to get tests, or still in line? And would you like to be the prioritisation of anyone who actually has COVID symptoms rather than just in a location of interest?
Look, the testing teams are doing an outstanding job. There aren't great wait times for testing, so I'm not aware of anybody who's not been able to get a test at this point. People who, and if you're talking about in Wellington, people who need to get a test are able to get one.
On the testing,
Well, I'm come back.
we've been at some of the central city testing sites today much quieter than the last couple of days. Is that a concern for you?
No, I think it's a sign that they're actually being very efficient at getting people through the testing sites, and we do have more of them. So the demand is now being spread over a greater number of sites. Derek?
The QR code scanning, is that something that you're categorically ruling out, making that mandatory?
I never really rule anything out, as you know, so we keep everything under review.
Do you have an update on the Janssen vaccine and when MedSafe is in that?
Can I come back to you on that? That it's any day that the advisory committee will be considering it, or that we will get the advice, and then we'll put that advice through to our COVID vaccination technical advisory group, and then through to cabinet for a decision to use. But
Previously, to clarify your previous comments around that, is that the length of time it's taken is sort of less to do with the clinical results and more to do with more technical aspects.
There was particularly around Pfizer. It was to do with actually the manufacturing, because they're manufacturing it at what I understand is a site that we haven't dealt with before. It's in the US. But the Janssen vaccine is in progress, well progressed, and we'll update you on that one.
All right, we'll
slow.
No.
We will wrap up shortly, but I'll take the last 4 questions. 1, 2, 3, 4, 5. There you go, have 5.
Minister, this morning...
Well, you're number 2, but we'll go number 1 up the back.
You
go on.
This morning, Minister David Parker, he was speaking about the assertion New Zealand's at the front of the queue for the global vaccine rollout. He said that you meant the AstraZeneca vaccine, not Pfizer.
No, I think so. You have to consider that was my comment, and consider that in the nature of what we were talking about at the time. We had a bunch of vaccines under development. None of them at that point had come to the market. Our advanced purchase agreements ensured that as they did come to the market, we were able to access them. We did access them, particularly the Pfizer vaccine. We started that in January, if you'll recall. We got relatively early access to the vaccine. But we made the decision also in January that we would narrow our campaign down to just using Pfizer and not use those other vaccines that we had advanced purchase agreements for at this point. And we were also pretty clear at the time that meant that we would be waiting till the second half of the year to get access to them in greater quantities.
You mentioned before it's been a year for you, I think, in this role. How would you evaluate the last year if it's up to your 1-year anniversary?
It's not quite, actually. I think it's the 2nd of July that I became Minister of Health. It's never been a dull day during that time. Every day is different with COVID-19. COVID-19 doesn't stop, and so as a result, over that period of time, I haven't either.
Your entire life.
It's certainly one of the bigger ones, yeah.
Bigger member Labour Party, 2011, 2017.
I've sort of blanked that period out. I don't really think about that anymore, yeah.
Have New Zealanders become too complacent to the risk of COVID-19?
I think we've become comfortable, and I think we always need to stay vigilant. COVID-19 is going to be with us for a while longer. And actually, vigilant doesn't necessarily mean giving up our freedoms. In fact, being vigilant is the way we keep our freedoms. So staying vigilant, doing those public health measures, staying home when sick, etc. And in the case of Wellingtonians and people around the country who have been in Wellington over the weekend, doing what we're asking of you, that is the way we make sure that we are keeping COVID at bay. Last question.
On that point, with the... on that point, my sort of rough math indicates that of the people who got tested in Wellington yesterday, probably more than half of them would have been people who hadn't been at a location of interest, so they were getting tested because they were symptomatic. We obviously don't get 2,000 tests every day out of Wellington. Is this indicating that people outside of a scare like this are symptomatic and not getting tested, and how do you deal with that?
I wouldn't necessarily draw that conclusion. Obviously, if people are symptomatic, then I'd encourage them to get tested. We do expect to see the numbers going up in the Wellington region because of we're asking more people to be tested. All right, thanks everybody.
The next communications over the weekend, because people will be wanting to know when they're going to hear from the government.
Look, we'll probably on Sunday. We will put out a written statement tomorrow. But if there's a need to come back here tomorrow, then of course we'll come back tomorrow. Thanks.